Good morning, everyone. Thank you very much for the APMF organizing committee who has already invited me to this very beautiful congress. So my talk is about the impact of the COVID-19 pandemic on Indonesian menopausal women. We know that currently approximately more than 700 million confirmed cases and almost 7 million deaths due to COVID-19 were recorded globally. There has been a decline in the number of confirmed cases and the deaths globally and also in Indonesia, starting from 2019 until 2023. And if we look the data from Ministry of Health Republic of Indonesia, 2023, the COVID-19 pandemic trend in Indonesia significantly declined and almost there is no new cases confirmed after June 2023. If we look about the definition of menopause, that menopausal age in Southeast Asia slightly lower compared to other developed countries. In Indonesia, it's approximately 50 years old, while it is expected that Indonesian women would live up to 73 years old. It means there's a gap about approximately 20 years of worse health outcomes compared to the productive age if this is left without proper management. Menopause involves in hormonal changes, which has been described as predisposing factors towards disease prognosis, hence lower quality of life. The COVID-19 pandemic impact on the psychophysical health of postmenopausal women may be already explained by a previous speaker. This is one of a cross-sectional study trying to investigate lifestyle, menopausal symptoms, depressions, post-traumatic stress disorder, and sleep disorders among postmenopausal women throughout the first wave of COVID-19 pandemic, including the impact of menopausal hormonal therapy. We can see this is the significantly difference is worried about not having access to the healthcare, starting from extremely 17.6%, and the rest is very much somewhat worry about 27.5% and 24.5%, and the little is 17.6%, and not worried only about 12.7%. The risk assessment of depressions amongst women during menopause, before and during COVID-19 pandemic, also very important. That menopause leads to increased depressive mood in 2021 as compared with 2006, in which there's also an increase of demand for support from husband and friends. This is assessing by menopausal rating scale scores and blood Copperman menopausal index. The COVID-19 pandemic has brought higher prevalence of depressions among peri and postmenopausal women. Depression, anxiety, and poor quality of life are significantly intertwined with the fear of getting COVID-19 infections, since menopausal women is a high risk condition of patients if they are infected by COVID-19. In the period of COVID-19 confinement, women of peri and postmenopausal age who engage with physical and sexual activity show high related quality of life along with higher resilience, while women were using antidepressant show lower health-related quality of life and resilience. Better health-related quality of life was also observed in women who live with other people. Although women had higher prevalence of COVID-19 infection, they showed lower mortality rate than men. COVID-19 infection rate were higher in productive age between 20 to 59 years old and decreased in advanced postmenopause. However, mortality rates in postmenopausal age were increased. It is suspected because of absence of gonadal stress in postmenopausal women. The use of ACE2 expressions. This is the permissive role of estrogen on ACE2 receptor that sometimes is like a blessing in disguise. The study showed there are a higher rate of predicted COVID-19 in menopausal women and lower rate of predicted COVID-19 in COC users with reduction in hospital attendance. Menopausal women, the hormonal therapy did not exhibit consistent association. In SRT user, it is found there's an increased rate of predicted COVID-19. The findings supported estrogen exposure has a protective effect on COVID-19. This is based on positive association between predicted COVID-19 with menopausal status and negative association with COC user. If you look this one, the association of menopausal status to predicted and tested COVID-19 result, the self-reported symptoms and indicator of COVID-19 disease severity, hospitalization, and need respiratory support. This is where highest odds ratio 1.6. They need respiratory support. The COVID-19 pandemic has highlighted the serious negative effect arising from the state of estradiol deficiency. Therefore, hormone replacement therapy gains further support as the major effect of decline in ovarian function affect many biological systems. And recently, with the COVID-19 pandemic, estrogen's vital role within the immune system has become quite clear. If you look this one, the expression of S2 and TMP are downregulated by the estradiol. So that's why the role of estradiol is quite promising. Does estradiol have an immune protective function in women against coronavirus? Both estradiol and progesterone are an important modulator of inflammatory and behavioral process. The steroid hormone have peripheral and neurological effect as well as anti-inflammatory. Estradiol in the high physiological concentration will inhibit the pro-inflammatory cytokines by macrophages for production IL-6, IL-1 beta, and TNF alpha, therefore blocking migration of neutrophil and monocyte into inflamed regions. On the other hand, progesterone suppresses pro-inflammatory cytokine production by macrophages and dendritic cells, such as interleukin-1b and interleukin-12. Estradiol and progesterone in high concentration stimulate anti-inflammatory cytokines and also enhance the expansion of Tregs, therefore promoting immune tolerance. This is a maternal immunity changes during pregnancy. We can see mobilization of immune cell, increase in Tregs, immunological recovery, maternal tolerance to fetal cell implants. So that's why effect of estradiol will reduce the viral infection and cytokine storm induced endothelial dysfunction will decrease disease progression, severity, and mortality. A modulator of renin-angiotensin-aldosterone system will reduce inflammatory response and in the resolution of inflammation. A major role in regulating lipid mediators and peptide for an optimal immune response. It will improving outcome in the fight against infectious agents such as SARS-CoV-2. Estradiol also have an anti-inflammatory effect on normal physiological level in premenopausal women. The result of WHI CAT trial, which involved 17,000 postmenopausal women, so there are no effect of vitamin D supplementation per day combined calcium carbonate on menopausal symptoms, either as a whole or as individual aspect, such as night sweat, hot flashes, sleep disturbances, fatigue, and emotional stability. The role of vitamin D as a supplement in menopausal symptoms has potential benefit regarding postmenopausal genitourinary syndrome. Showed an improvement in vaginal atrophy over placebo. Vitamin D was administered as vaginal suppository at daily doses of 1,000 IU or orally 60,000 IU weekly doses. This is assessed by vaginal maturation index, vaginal pH, and visual analog scale symptoms. Menopausal hormonal treatment has a few complications, particularly for women in the early state of menopause. Early menopausal hormonal treatment, perimenopause intervention is advised to preserve energy, metabolic homeostasis, and improve average life expectancy. Early onset hormonal treatment initiation may be beneficial, while delay onset hormonal treatment initiation may be harmful. Menopausal hormone therapy such as tibolone and the combination of conjugated equinestrogens is the most effective treatment for vasomotor symptoms associated with menopause at any age. Benefits are more likely to outweigh risks if the treatment is initiated for symptomatic women below than 60 years old or within 10 years after menopause. Menopausal therapy for women with obesity, with some considerations that oral menopausal hormonal treatment increasing the risk of thromboembolic disease. So that's why transdermal route will be preferred due to decreasing risk of thromboembolic disease. Tibolone therapy carries a lower risk of thromboembolic disease, but it has been associated with body weight gain. Low vaginal estrogen also will increasing thromboembolic risk. How menopausal therapy for the women with obesity? Recommended doses is lower dose of CE or lower dose of estradiol or using transdermal estradiol. For women with confirmed suspected COVID-19, any type of systemic hormonal treatment should be stopped for the whole period of isolation or hospitalization with serious consideration. The COVID-19 hormonal treatment recommended only after fully recovery and restoration of complete morbidity, and it is advisable to consider changing to transdermal therapy. The connection between COC user, COVID-19 positivity, and its related outcome in almost 300,000 patients, women aged 18 to 45 years old, women in the both pre and postmenopausal women were included. Majority were from premenopausal. Almost 55,000 COC users with COC as only form of hormonal therapy. Women using COC had a lower rate of predicted COVID-19 and corresponding reduced frequency of symptoms, including persistent cough, delirium, anosmia, skipped meals, and severe fatigue and pain. To evaluate the efficacy of 3 doses of estrogen and progesterone therapy for Lily vasomotor symptoms and vaginal atrophy in Asian women, Professor Delphine Tan do this study to examine difference in prevalence of vasomotor symptoms among ethnic groups. And we can see Indonesian populations have a lowest prevalence of vasomotor symptoms in 9 ethnic group of Asian women compared to other women from other countries. And this is menopausal symptom in Indonesia during COVID-19 positive era. Number one, we can see the weakness, followed by the muscle pain, and then followed by frigidity. And since the vasomotor symptom is quite low, I think this is the most common symptom of menopausal in Indonesia. It's not changes even in COVID-19. And how about in vaccinated menopausal women? Again, still, number one is the weakness, very common, followed by fatigue, then followed by muscle pains, rigidity, vaginal dryness, and also irritability. This is a 3 big common symptoms in menopausal women in Indonesia after after receive vaccine. And then this is also with the vaccinated menopausal women with history prior infected by COVID-19. Number one is dominated by weakness, followed by muscle pain and fatigues, and then the last with frigidity. This is the common symptoms of Indonesian women in COVID-19 pandemic era, before vaccine, after vaccine, and after vaccine, and if with the history of infected. So as a take-home message, the presence of estrogen in women is one of the protective factors against infections such as the COVID-19 infection. Estrogen, especially estradiol, play a very important role in regulating inflammation response and immune cell function. Hormone therapy is advised to be initiated for symptomatic women below than 60 years old or within 10 years after menopause. For obese patients that is suspected of confirmed to COVID-19 infection, please be very careful to stop hormonal treatment use until isolation period is over. Menopause most common symptom in Indonesia during COVID-19 for the vaccinated or not vaccinated yet, prior COVID-19 infected or not, there are mucus, muscle pain, rigidity, vaginal dryness, and irritability. And so as usual can be used to reduce symptom of frequency of COVID-19. And then vitamin D supplementation has potential benefit for postmenopausal genitourinary symptoms. This is my last slide. Thank you very much for your kind attention. Good evening.